Hey y'all, it's Dr. Taylor Cox with Campbellsville Dental Care. We're starting a new series that I'm calling hashtag Tooth Talk Tuesday. This is going to be a weekly live video that we put out each Tuesday where I answer some questions that I most commonly hear when I'm speaking with patients and hanging out in the practice here with some of our patients. And the first one, this is probably the biggest one that I hear the most often, and it's, "Hey doc, is this going to hurt?" I get it. I know that not everybody is as excited as I am to walk into a dental office every day. But I usually hear this question in one of two different scenarios. The first one is before we're preparing to give an injection to numb part of the mouth. I've had those injections. I get it, okay? But we've got a couple different things that we do to help make that experience not quite as unpleasant for you. We special order an extra strength topical anesthetic that we can place in that area before we have to give the injection to just help numb the area so that that experience is not as uncomfortable. But also my staff and I have several different kind of tricks and techniques that we'll walk you through to just help relax the body a little bit so that that experience is not as bad. And the biggest thing is we'll talk you through each step of the process so that you know what's coming and you're not surprised as we're going through that process. So that's probably the most common thing that people are concerned about with pain. But I also hear it a lot at the end of an appointment when we're finishing up and we're getting ready to dismiss the patient, and they say, "Hey, am I going to be in a ton of pain tonight? What can I expect?" I'll be completely honest. Dental procedures are like a lot of medical procedures. Sometimes there's a degree of discomfort that's part of that post-op healing experience. And if that's the case, I take time with each of my patients at the end of the appointment to give you specific instructions for what you need to know to keep that pain at a minimum, and different things that you can do to help you heal a little bit faster and just kind of have a happier healing period. And then I also make follow-up calls with my patients at the end of the day and a couple days out just to make sure that the healing process is going as it should. So we all understand pain is a concern. I don't want that to be a barrier for you to come in for a dental appointment. So we've got several different options here in our practice if you're a little bit anxious. On the simplest end, we've got monitors and headphones in our operatory. So if you just want to check out a little bit because you don't like the dental environment, that's cool. We can turn on Pandora or internet radio, TV. You can watch whatever you want to while you're coming in for the procedure. But if you're a little bit more anxious or you really have a true phobia of coming in to see the dentist, don't let that discourage you from coming in for an exam. Come in and talk to us because we've got several options that we can do to help you relax for your appointment and make you feel a little bit more comfortable when you come in. So hopefully that answers your question. If you're concerned about pain, now we've got several other questions lined up, but if you've got a specific question you'd like to hear us answer, leave us a comment on this post or send us a message on one of our social media accounts on Facebook or Instagram, or shoot us an email. We'd be happy to hear what questions y'all would like to have answered. So we'll do this again next week, right around lunchtime on Tuesday. And y'all take care until we see you next time.